So guys, I'm here at the 24th Annual Dermatology Conference, and they have an Apple Award prize that's given to the best presenter and the best presentation that shows most relevance here in the Caribbean. And when they was up on the podium and they were saying that alopecia is a huge issue, and then they said, Dr. Kyjuan Brown, guess what guys, I was awarded the Apple Prize. This is my very first presentation here at the Caribbean Dermatology Association conference, but they saw fit to award me the Apple Prize for the most relevant presentation that speaks volumes. I'm floored, absolutely. Alright, so as we see with this patient here, she has thinning of her crown. As women lose hair, especially when it's androgenic alopecia, which is hormone-based hair loss, they start to have a widening of the central crease, or the central part, and we can see that very evident here, where if she doesn't do anything, she's going to lose a lot of the hair on the crown, always maintaining the apex of the peak, but losing more of the crown. So part of our hair exam and scalp analysis is also to take trichometry measurements, and we use this ruler so we know exactly where we are all the time, and we can go always back to that same spot. So we're just taking, we're marking a treatment zone, and also we're going to mark a control zone at the back. We then use the trichometer with a hair track device, and we take a measurement. 56. Let's do hair breakage index. 46. And 41. So the density is 56 at the base. As we're going up the shaft, it goes down in density. So we're going to tell this patient that she has some breakage issues, because as our hair is growing, it's breaking off. So the hair in 78. So remember, the treatment zone was 56. The control area is 78. And still in this area, her hair is breaking off because it started at 78 and it's gone down to 56. A part of the assessment is to take hair cam pictures, and this is where we look at the nature of the hair follicles under a high-powered microscope, and we take pictures. That red dye is just our location indicator, so we know where we are. Laser treatment is also an effective method of hair treatment, and we use this laser device that emits red laser light in the spectrum of 645 nanometers. We place this on the scalp, and what it does, it helps to provide more energy to develop to the hair follicle, as well as blocks the conversion of testosterone to DHT. And this would help for her, especially with her androgenic alopecia, but it helps with all patients with any form of hair loss. So this is another device that we use in office it's just a lamp, so it covers a lot greater area in reference to here, so we can cover the sides and the back. We can also turn it around to cover the back as well. But same concept. This, instead of using laser, this is LED phototherapy. Very effective for hair restoration and hair growth of all sorts.
From WPTV, this is Today on 5 at 11.
Okay, so still ahead, no more thinning or balding hair.
Right after the break, we're going to find out why hair loss happens and effective ways to treat it.
Welcome back. Well, everyone loses hair. It happens during your morning shower, as you're blow drying your hair, when you give it a brush. That's all normal. So if you begin to shed significantly more than that, or you notice it isn't growing back, that could be frustrating. So here to tell us about that and talk to us about some solutions for hair loss, this is Dr. Alan Bauman. And thanks so much for being here.
Hey, thanks for having me, Ashley. This is great.
Yeah, we talk about hair loss. What are some of the causes that are common?
So we see a lot of causes of hair loss in the practice at Bauman Medical Group. It could be from scarring, from illness, from surgery, from stress, but mostly it's hereditary. So you're going to get it from your parents, mom's side or dad's side. For men, it's going to be a receding hairline. It's going to start to thin out in the crown. For women, it's going to thin out behind the frontal area.
So here, okay, interesting. So it is both men and women. Good to keep in mind. Talk to us about some of the hair follicles. So if the follicles are actually dead, I know that there's, live hair follicles, dead hair follicles. What are the options
So
there?
there's a lot of in between, right?
Okay.
So as the follicles miniaturize from male pattern or female pattern hair loss, there's a time to invigorate them. So you can use topicals and other medications, oral medications, laser light therapy like the laser cap, or even injectable treatments. But once the follicles are dead and gone, then you're going to need a hair transplant to fix the problem.
Okay, so better to kind of go into this a little on the earlier side if you can.
Correct. So you're going to need measurements, you're going to need to find the right expert to actually diagnose what's going on, track your progress with your treatments, and guide you through what's working and what's not.
Yeah, because there's so many different options now. The process, I mean, we have some things up here. If you don't mind, let's take a look at this, because I see it's flashing. This is a baseball cap, right? With
so it's a Capillus laser. The Capillus RX has over 300 diodes. Low-level laser therapy is a non-chemical, non-invasive way to stimulate better hair growth. It's FDA approved, and it's a great treatment option at home, and actually one of your least expensive treatments over time.
Wow, and you think it's just that easy, huh? That's
6 minutes a day, that's all you need.
Okay, that's kind of interesting. And I mean, I know you have shampoos, you have different options out there. Talk to us, though, you mentioned this hair transplant. Is this something that's a long-term solution? What are we looking at with that?
So hair transplantation is a permanent solution to hair loss because we take the follicles that are permanent from the back of the scalp. Now we do it individually with no scalpel, no stitches.
Wow.
Devices like the Smart Graft, which is amazing technology, enables us to individually implant the follicles one at a time. So no linear scar left behind, no major downtime, very little discomfort, if any, and you get permanent hair regrowth from that, and it looks good and feels great to have hair back.
Yeah, so people, I mean, might be thinking about what they used to see years ago in terms of a hair transplant, and it's not like that anymore.
Correct. This is not your you're not your father's hair transplant. It's not painful, it's not pluggy, and it's not going to leave you with a visible linear scar in the back of your scalp anymore. This is the latest and greatest.
Okay, so I know you have some before and after pictures. These are always so dramatic because you can really see close up. What type of treatment is this?
So we're looking at Brian. Brian has male pattern hair loss, and he came in with this thinning process, receding hairline, and we use the Smart Graft device to restore his hairline.
Wow.
So this is an FUE style hair transplant that leaves no linear scar in the back of the scalp, and he's got permanent living and growing hair in the old location now forever.
I mean, in terms of the personal side of this, hair loss, I've had female friends and male friends dealing with that. What kind of a personal thing can it do for somebody to have that restored?
Well, first of all, if you're experiencing hair loss, that can be a panic situation, right? You don't know what to do, who to turn to. It makes you feel older, look older. People might look at you like that you're sick or something like that, not doing well, that you're older than your stated age. So when you restore your hair, it restores that confidence. It gives you a psychological boost. It makes you look good and feel great.
Okay, well,
that's what hair's all about.
Yeah.
Turning the clock back a hair.
They call it for your crowning glory. Turn it back a hair. There you go.
Absolutely.
All right. Well, thanks so much for joining us.
Thanks, Ashley.
I want to
Thanks for
send
having
things
me.
over to Felicia.
This is not you're not your father's hair transplant. It's not painful, it's not pluggy, and it's not going to leave you with a visible linear scar in the back of your scalp anymore. This is the latest and greatest.
You've probably heard people say that if your mother's father was bald, you're more likely to lose those beautiful locks of hair down the road. But what truth is there to this? It turns out that one of the major contributors to hair loss is sex-linked. Humans have 46 chromosomes of DNA, of which 2 help to determine your sex, the X and the Y chromosome. If you're a female, you have 2 X chromosomes, but if you're a male, you have an X and a Y chromosome. Studies show that the most influential hair loss gene is located on the X chromosome only. What does this mean? Well, if you're a male, you get an X chromosome from your mother, but must receive a Y chromosome from your father, because if you got your father's X chromosome, you'd be a female. So if one of your mother's X chromosomes has this hair loss gene, you have a 50-50 chance of getting it from her. In this way, hair loss is partially hereditary and passed through the maternal side for males. Females, on the other hand, must get 2 copies of this gene, one on each X chromosome, in order to physically express it. So if your mother does express these traits, it means she will be passing an affected X chromosome to you. But why do we say to look at your mother's father? Well, if he has visible male pattern baldness, then your mother has at least 1 copy of the affected X chromosome from him. Because in order to have a daughter, he must have passed on his X chromosome, not his Y. The thing to note here is that this is just one of the contributors to hair loss, and while it's thought to be the most significant, many studies have found other hair-linked genes which aren't sex-linked at all, including some on the Y chromosome, meaning they can be transferred from both the mother and the father. On top of this, some studies have shown correlations between age, exercise, nutrition, and even stress levels. So while a quick check of your mom's dad's hair may be an indicator for future hair loss, a head full of hair on grandpa's head doesn't guarantee you're in the clear. Got a burning question you want answered? Ask it in the comments or on Facebook and Twitter, and subscribe for more weekly science videos.
To understand how hair grows, let's look at the different phases of the natural hair growth cycle. The cycle starts with the anagen or growing phase. A new wispy hair like baby hair emerges from the follicle and pushes out the old hair. Growth signals and nutrients start to enter the hair through the bloodstream, and a hair strand grows healthy and strong. The anagen phase can last between 2 and 7 years. This is when the hair is attached to the dermal papilla. The longer this phase lasts, the longer your hair will grow. As we get older, the anagen phase gets shorter, so hair may become thinner after each cycle. We then enter the catagen phase, which is the transitional stage that lasts about 10 days. This is when the hair detaches from the dermal papilla, which takes us into our telogen phase, or resting stage. This phase lasts about 3 months, and as the old hair is no longer attached to its blood supply, it can't be repaired and can appear dull and lifeless. Another new wispy hair emerges from the follicle and pushes out the old hair, and the whole cycle starts again. Around 15% of your hairs are in the telogen phase. That's why you shed hairs all the time. Your head of hair is made up of about 150,000 follicles. Around 85% are in the anagen or growing phase at any one time, so it's normal to shed an average of 100 hairs per day. If, however, you're shedding more than 100 hairs a day, or if you notice your hair getting thinner and lifeless, it could be due to a number of factors, from poor diet and stress to age, hormonal changes, or medication, and you may wish to seek medical advice.
Growing up, I used to have really thick hair. In fact, I hated it that it was so thick. About 15 years ago, I was losing a lot of hair. It was in the shower, coming out in clumps. I would have to empty my brush constantly. I was like shedding like a dog. I was under a lot of stress. I totally think that the stress contributed to my hair loss. Got it layered recently to make it a little bit thicker back here, but you can still see it's hard to hide the temple. My question is there anything I can do to stop my hair loss and boost the thickness?
We invited Joanne here today to meet with hair restoration specialist Dr. Alan Bauman. Thank you both for being here. And we have you here to talk about solutions, but first things first, let's just talk about hair loss and why it happens.
Yeah, and you know, it's very important to understand that there's a big difference between the way men and women usually lose their hair. If you look at the animation, with men, hair loss typically tends to start around the back of the head, and it's very, very common then to see the loss up in the temples. But that's what we call the male pattern of hair loss. With women, it tends to be around the scalp, so you see a widening of the scalp, but you can also sometimes see hair loss in the front by the temples. I see this a lot in women in my practice, and it is so upsetting. But I think it's important to understand, you mentioned you were under stress. Day-to-day, daily average stress shouldn't really make you lose a lot of hair. We'd all be pretty much bald if that were the case. But big hormonal changes, some vitamin deficiencies, thyroid problem, and then of course things that you do yourself to your hair, styling and coloring and things that you're mechanically doing can also play a role. But I normally tell women that if they gently pull on their hair, it's normal to see a couple of hair strands come out, up to about 10. To lose about 150 strands of hair in a day can be normal. When you start to see big piles of hair on your brush like you did, Joanne, or in the drain, that's when it can be helpful to see either a dermatologist or a hair specialist.
And really what we're talking about here is the importance of the hair follicle, right?
Yeah, that's right. So in my practice at Bauman Medical Group, we've treated thousands of patients over 17 years with medical therapies like prescription medications, injections like platelet-rich plasma and stem cell therapy,
all for hair
transplantation in severe cases, and of course, low-level laser therapy. That's what we're talking about today. We have portable devices that literally fit underneath your baseball.
So no one would even know that you're wearing these lasers that are helping you restore your hair, and it can be under a beautiful, fashionable hat.
That's
correct.
amazing.
So the laser cap contains 224 laser diodes that deliver the same clinical dose that we would normally give in the office. And so patients can use that at home, you know, while they're watching TV, walking the dog, driving in their car.
Totally. So Dan, I want you to watch this. We're going to show you on this medical wall what Dr. Bauman's talking about, because this is exciting stuff.
Yeah, so everybody in their teenage years starts out with a thick, full, healthy head of hair because the follicles are producing thick, shiny, good quality hair fibers over time. But because of heredity and other factors, social factors, environmental factors, these follicles can shrink and wither. And what happens is that you miniaturize these hairs. So with laser therapy, we can use this is a non-chemical, non-invasive way to stimulate cellular metabolism. So this light energy is converted at the level of the follicle, the cellular level, and these follicles are going to get thicker, stronger, and healthier over time.
And it's an additional treatment to, you've talked about the pharmaceutical treatments, et cetera. It's treating the hair follicle in a different way.
Right, and I also recommend, you know, for you at home, you can try biotin. There are some over-the-counter hair growth topical treatments that can be very effective. You just have to remember to change your pillowcase every night if you're going to use them so that hair doesn't grow on your face where you don't want it to grow. But the best news, Joanne, and we'll actually have more of those tips for people on the website about ways that you can stimulate hair growth. It is important to remember, as I'm sure you tell all your patients, Dr. Bauman, it can take up to 6 months to see changes in the hair growth on your head because of the life cycle of a hair follicle.
Right,
The best news for you, Joanne, is you are going home with one of Dr. Bauman's laser caps.
Thank you. You're welcome.
And I think we have some before and after pictures so you can see what to expect. I mean, the results are pretty impressive.
So now, since we've extracted the blood, we spun it down and separated it. Red blood cells, compacted red blood cells. We have protein poor plasma, and then we have protein rich plasma. This gray area is the area that we want because this has all the cytokines, growth factors that we need to actually re-stimulate growth. Wound healing, we can do hair growth. We can do this. Can be injected in knees and joints for arthritis to try to regrow cartilage, etc. So we're about to start the PRP procedure. We're just outlining the area. Here's a young gentleman that is starting to have some regression or some loss of hair in his temporal peaks. And we're going to do the PRP procedure today in an effort to restore it. We're just marking the area and we're going to start the anesthesia process. Usually the first stick is the worst, and then we go into the area that we just anesthetized. We're going to do a complete ring block around the area to give a good coverage of anesthesia. This procedure, patients can normally go right back to work. Most of our male patients go right back to work after this procedure because it really is, it's not that dramatic as it may seem. Tomorrow he may just have just some slight pain and some swelling. Otherwise, they're fine and they can resume normal. So now we're starting the PRP procedure. Here we have the syringe full of PRP mixed with some other additives that are essential for hair growth. And we're going ahead and start to inject the PRP into the scalp. He shouldn't feel any of this, no?
No, I don't feel
Good. We're going to heavily concentrate it, of course, in the areas that need the PRP the most, and then we'll put it around the other areas that need it the least. So now since we've done the PRP, we're now going to create dermal injury, because we actually want to cause injury to the hair follicular unit in order to activate those growth factors to say, okay, we've got to start to repair them and hopefully repair them normally. So the patient doesn't feel any of this procedure. You doing all right?
Yeah.
Good. Are you feeling any of this?
No.
Now we're about to do the injection of the A cell. The A cell is immunoprivileged cells from the pig's bladder. And the reason why we do this is pretty much the building blocks of life, not life per se, but tissues. So it has all the growth factors and whatnot that help the area to regenerate a lot faster. So we inject this also into the scalp. You all right? Now we're just dropping some more of the PRP on the rest of the area. It doesn't really need it, but because the male pattern baldness location is normally the top of the head, you know, we want to also start to mitigate any further losses to this particular area. Drop it all. Okay, we're going to sit his... So now we're just cleaning off the area and going to get him ready for light therapy. So the procedure is now finished. But if the patient, aftercare is very simple. If he has any, some more gauze please. If he has any pain, you can just take some Tylenol. Panadol will be preferred. No anti-inflammatories, and he should be fine. If he bleeds a little bit more, we'll probably tell him to sleep with like a nightcap or something, one of those plastic coverings, just so it doesn't get all over the pillowcase. But otherwise than that, he's good to go. Let's clean up some more. How are you feeling?
Good. Just relaxed, to be honest.
So he will sit under the laser light for about 10 to 15 minutes, and then he'll be on his way home.
FUE hair transplant is a proven medical procedure, improving men's appearance and confidence. In a hair transplant surgery, receding, thin or bald areas are covered with the hairs harvested from the donor region, marked with the blue color in the video. Before the surgery starts, local anesthetic is applied so the pain is minimum. The surgery has 3 phases. First phase, also called the harvesting phase. Each hair follicle is taken one at a time using a microsurgery device. The collected hair follicles are arranged based on how many individual hair strands they contain. Those hair follicles are kept in an advanced storage solution called hypothermosol, FRS, to achieve maximum graft survival rate. After we've finished harvesting the necessary amount of hair graft from the donor region, we then proceed with the second phase, which is also called opening channels. In this phase, Dr. Tayfun Oguzoglu carefully opens holes for the new hair follicles to be planted in. This part is known as the most crucial phase. Third phase, hair follicles are implanted to the open channels on the recipient zone, one by one. With 20+ years of experience, Dr. Tayfun is known by his natural-looking hairlines and dense implantations. After hair implantation is finished, we spray our patients' heads with ATP-V solution, which provides nutrient-buffered environment for cells experiencing environmental stress. ATP signaling results in increased inflammatory response that can lead to a greater cell proliferation as well. If done by an experienced doctor using correct equipment and advanced medical solutions, FUE hair transplant is proven to improve men's appearance and confidence. If you'd like to get more information about hair transplant or would like to know if you're a good candidate for hair transplant, please contact us.
I'm Dr. Arthur Gray, and I run the Hair Transplant Restoration Center in Macon, Georgia. I'm excited to introduce you to a new hair restoration treatment system. This treatment focuses on your scalp and as a result restores your hair to its most vibrant and healthy state. To take care of your hair, you first need to take care of your scalp, which will proactively combat the source of many problems. Our goal is to treat the scalp in order to bring your hair to a new, thicker, and healthier life. We take active ingredients from the skincare and apply them to the health of your scalp. The active ingredients aim at stimulating microcirculation, nourishing and balancing the skin in order to give structure to the hair. We perform a tricha test or a scalp and hair analysis to custom build an individualized treatment plan, which will consist of blending different types of products from a large number of options. And only through our scalp tricha test evaluation can you truly identify and treat the origin of your hair issues. One goal is to restore the balance between hydration and oil on your scalp. After analyzing your skin conditions, specific products, technology, and expertise are combined to form a precise treatment plan for your scalp. We then provide a relaxing, enjoyable facial for your scalp, using the products that best fit your needs. Our custom treatment plans are not substituting for a haircut or blowout, but rather forming a strong head of hair to maximize the work of your stylist. By giving you the tools and education to build healthier hair, your individualized program can be continued at home, which will enhance your cut and color in between visits to your salon.